Assalamu alaikum. Today's article is titled Clinical and Radiographic Outcome of the Root Canal Treatment of Infected Teeth with Associated Sinus Tract. It's a retrospective study conducted by Siqueira and his group from Brazil. It was published in 2021 in Australian Endodontic Journal. Chronic apical abscess is a form of apical periodontitis caused by bacterial infection of the root canal and characterized by periapical radiolucency associated with an intra or extraoral sinus tract. The prevalence of this condition is 18.1%. So, 1 in every 5 teeth with periradicular inflammation will be presented with sinus tract. Histologically, a granulomatous tissue with inflammatory cells and lined by epithelium. And also, same group found that chronic abscesses contained granulomatous lesion with areas of liqueficative necrosis and neutrophils surrounded by macrophages. And the purpose of this retrospective study was to report on the clinical and radiographic outcome of the root canal treatment or retreatment of teeth with chronic apical abscess with an intraoral sinus tract. The material and methodology cases included in this study were selected from 144 patients who were referred to a specialist in endodontics in a private practice for endodontic evaluation because of the presence of an intraoral sinus tract. The inclusion criteria were as follow: teeth with a sinus tract and radiographic evidence of periradicular bone destruction, tooth with a necrotic pulp confirmed by pulp tests or with previous root canal treatment, tooth that was restorable and had an indication for root canal treatment or retreatment, tooth with a mobility score of less than 3 and absence of periodontal buckets of more than 4 mm deep, and finally patients without significant systemic diseases. As for the endodontic treatment or retreatment procedures, of the cases with preoperative presence of a sinus tract, 137 teeth met the inclusion criteria and were subjected to root canal treatment or retreatment by a single operator and in a single visit whenever possible. An additional visit with intra-appointment calcium hydroxide medication was made necessary in more anatomically complex cases or when a dry root canal could not be achieved before obturation. As for the follow-up, healing of the sinus tract was recorded during follow-up examination performed at 7, 14, 21, and 30 days postoperatively. And regarding the periradicular tissue healing, patients were followed up periodically ranging from 1 to 17 years. And for radiographic follow-up examination, preoperative, postoperative, and follow-up radiographs were compared to evaluate the fate of the apical periodontitis lesion. And according to the clinical and radiographic evaluations, the outcome was classified as either healed if the tooth was asymptomatic and functional, and the sinus tract disappeared and there was no radiographic apical periodontitis lesion; healing if the tooth was asymptomatic and functional, and the sinus tract disappeared and the apical periodontitis lesion is decreasing in size; and diseased if the tooth was asymptomatic and non-functional and the sinus tract persisted or recurred, and or the radiographic apical periodontitis lesion was unchanged or enlarged. Now moving to the results, of the 137 teeth that were subjected to root canal treatment or retreatment, 70 teeth were followed up for less than 1 year. And of the cases followed up for less than 1 year, 4 presented with persistent sinus tract for more than 1 month, and 1 retreatment case had a recurrent fistula after 4 months. And at the end of this study, 72 teeth were evaluated, 67 of which with more than 1 year follow-up, clinical and radiographic evaluation. And the overall healed rate for the 72 cases with preoperative sinus tract was 73.6%. 74% for the initial treatment and 72% for the retreatment cases. And they also found that teeth with a small periradicular lesion of less than 5 mm in diameter had a healed rate of 88%, while lesions that were large, 5 to 10 mm, or very large, more than 10 mm in size, completely healed in 72.7% and 54.5% of the cases respectively. And most of the sinus tract occurred on the buccal side, and the most frequently affected teeth were the maxillary molars. and the large majority of cases were treated in one visit with a healed rate of 79%, and more complicated cases required 2 or 3 visits and received an intra-appointment medication with calcium hydroxide. And in these complicated cases treated in 2 visits or more, the healed rate was 63.6%. And moreover, teeth with radiographic evidence of filled lateral canals exhibited a 75% success rate as opposed to 73 success rate of cases with no evidence of lateral canal filling. And no difference in outcome was observed for teeth with different root canal obturation techniques. The type and quality of the coronal restoration did not influence the outcome. However, its absence had a significantly negative impact. And 5 cases that had the sinus tract healed before 1 month exhibited recurrent sinus tract after 4 to 29 months and were also regarded as diseased. These 5 teeth were associated with persistent radiolucencies. Therefore, 4 teeth with persistent sinus tract and 5 with recurrent sinus tracts were categorized as diseased and were retreated, subjected to periradicular surgery, or extracted. So, as a conclusion, the quick closure of the sinus tract and the later healing of the associated periradicular lesion are both reliable upon effective control of the intraradicular infection by treatment or retreatment procedures, and persistence of a draining sinus tract for more than 1 month or its recurrence after treatment indicates the presence of a persistent intraradicular or extraradicular infection that needs to be managed by retreatment, surgery, or extraction. And although closure of the sinus tract in the first month following treatment may be a good predictor of favorable outcome, a longer follow-up visit should be instructed as the sinus tract may recur.